Hi there, Ramon here from Memories, and we have our next caregiver spotlight, and I'll throw it over to her to introduce herself.
Hi, my name is Naaz Fatima Khan, and I'm from India. And I'm pretty much excited about this session because what I'm really looking forward is to talk about this disorder because I have never talked about this in this here in around me or different states. So I've been really looking forward to talk about my experience and at least share my story.
For sure. Well, thank you for being here. We're super excited to hear your story. How long have you been a caregiver?
I would say for about 6 years.
6 years. Wow. And who were you a caregiver for?
My mother.
And what 6 years ago, what was the diagnosis and the early stage like for you and your family?
Yes, actually, it was 5 years or 5.5 years ago when my mother was diagnosed by that because we have no idea that this is going to be happen. So first we were taking treatments for her knee injury, sort of injury had was there in her knee. So we were planning to get her knee, operated for the replacement because she was having some difficulty in walking. So for that, we went through some test or some diagnosis. Then we got to know that she is having that dementia. So that was quite a shock to us because we had no sort of history. We had no sort of idea or expectation. So that was shock. So from then till now, we are going through different stages. And what I'm trying to do, or my family is trying to do, to give her the best life, the best love and care we can actually give to her. So that's all.
For sure, for sure. Thank you for sharing that. And how has the past 5, 6 years been emotionally for your family going through this experience?
If I talk about personally, that it was very evolving. As a daughter, as a person, it has a lot of impact on me because my mother used to be a different person before that 6 years, and after 6 years she has been transformed into different, altogether different personality. She has no sense. She has that what she's doing and what she's really craving for, what she can um, do with us, nothing, no sense. And gradually by year and year, she has been, literally like a child. So the mother has been transformed into my child. It seems like that. So personally and emotionally, I have been drawn towards very much uh, emotionally strong person, and I would say sensitive also, because day by day when I saw her, she is not able to do small things. She is not able to eat properly. She is not able to at least have that sense that I am her daughter. So that really, touch that part of as a person where we can become more sensitive towards the person and towards ourselves. So yes.
For sure, and I love how you mentioned this growing sensitivity. It's a very difficult experience to go through, and it allows you to look inward and also allows you to re-examine the relationship with that person. So thank you for building that up, bringing that up. What does support look like for your family dynamic? Are you the sole caregiver? Are there other caregivers in the house? What does that situation look like for you?
Can you please repeat the question
Oh,
because there is
sure thing. Sorry about that. I was asking, what does support look like in your family? Are you the sole caregiver, or do you caregive alongside other members of your family? What does that look like for you?
um, actually we have, first of all, in the first place, we really felt fortunate enough that we can give support to our mother because in our surroundings and in our family, friends, or relatives, we haven't witnessed that anyone has the disorder. So first, when we have that, so what we try to do is to understand, because it was very new to us. We have no idea what it is and what we are supposed to do in that case. So we all came together, and we had no such feedback from anyone or reference from anyone, and we have no such stories in our head that that person is suffering from that disorder and that family is taking care of that person in that way. So we had no such experiences. So what we did is coming together and putting all our efforts in, taking care of our mother. So that's all we did, and that's we are doing till now, and we'll do in future as well.
For sure, for sure. And thank you for sharing that. And it is very challenging, especially for people who it doesn't run in the family. You've no prior experience or exposure to it. So it can be very challenging to adapt. And I think it's amazing that your family and family friends have been able to come together in this really supportive way. My next question to you would be about self-care. I think caregiving can be very overwhelming. There's so many tasks that come with it. So how do you make sure that you're doing well emotionally when things get really challenging?
When it's about self-care, I would say that after treating or taking care of my mother, I have been very much aware about self-care. Uh, I know it's very frustrating and very difficult to take care of a person who is suffering from this disorder. So first of all, what I really think that who is taking care of anyone in this particular category, she or he should be very calm, first of all, very understanding, because in your head, in your mind, you need to be very positive about this uncertainty of this disorder. Because day by day, what I feel, what I have experienced is phases comes. Once she is very angry, and then suddenly she's like normal person, and it seems like she's another person. So to shift from one phase to the other, one has to be very stable in their head. So what I practice is, first of all, I try to understand that she is not the same person and she really needs us. So first we have to be very calm, very understanding, because she is not the one who is going to understand that, it's us. So we try to be very calm, even if she throws some things around, and she tries to beat us and she does a lot of things. So what we do is that, okay, fine, we try to and light up the environment and the time particularly. So in that in that area, what we do is to calm ourselves, and even if she feel that we are failing to understand the situation, we try to substitute ourselves. If I'm trying to if I'm failing in that particular situation, I'm not trying. I'm already have something in my head, and I'm not that much aware of about that situation. So what I do is I try to put somebody else in that particular time, and I try to leave that space, because I cannot complicate the situation any further for her. So through her, I've come across that particular thing, that everyone should be very much aware about his or her mental status if something is bothering. Because in my mother's case, the cause for Alzheimer was uncontrolled hypertension. So that particularly always strikes in my head, that I should not be the one who has that stress or who has that uncontrolled pressure on my mind. Because ultimately, what can really trigger your mind to go into that stage, nobody knows. So yes, after experiencing my mother's disease, I'm taking care of myself very well, at least for my mind.
For sure. And I think that's so important to bring that up. One, to be understanding, because the person going through this experience right now is having a really difficult time as they fade away. And it's important that us as caregivers are really understanding of where they're coming from and react in ways that are appropriate. And I think it's also lovely that you touched on the importance of self-care, because we can only care for someone else if we're the best versions of ourselves. So it's important for caregivers to check in with themselves and make sure that they're doing well so they can be the best caregivers they can be. So thank you so much for sharing that. My next question is about the pandemic. I think the whole world has been put on pause. A lot of our lives have changed drastically, and caregivers already have such a difficult role. So how has the pandemic affected your caregiving experience?
That is true. It has been, very much changed now, and for everyone around in the world. So in that, my mother's case, what really, the first thing which has been really affected is the communication between our doctors and my mother. In fact, me as her attendant. So, because hospitals are closed, and in that particular section, because they're not treating or they're not inviting the patients from the other category, other than if the person is suffering from that COVID or fever, and that symptoms are like that in that direction. So I cannot take my mother to that particular hospital for that regular checkup, or even if she's having some difficulties in sleeping or in her, temperament or something behavioral changes. So that is very effective. And second, I would say that it's hampering me on the other side, because when I used to go outside, because the work has been affected, the outside meetings have been affected. So right now, maximum of us are bound to the homes only. So when we used to go out, when we used to go to the normal regular work, then definitely we used to have a break. But right now it's all like 24/7 duty of caregiving. So that's the only effect, but that is manageable, because we know that we cannot do things normally as we used to do before this COVID happened. So that is the only thing happened. Otherwise, it's all under control and manageable. So we are doing the same thing. We are trying to be in front of her every second. So it's not that difficult for us, actually, fortunately.
For sure, and I think thank you for sharing that. Even that difficulty of seeking medical attention for those regular checkups has put a strain on your family. So, and I think a lot of people who are caring for loved ones with Alzheimer's are currently experiencing that. I think it's important to talk about that because it certainly is a big change. So, thank you for sharing that. My next question to you would be about you as a caregiver. How have you grown or changed as a person over the past 5 years because of this difficult experience you're going
Mm, the whole experience, if I say, as a person, as I said earlier, that it has been very helpful, very impactful on me as a person or as a daughter. Actually, it has been categorized in two categories. One is as a daughter, what I received, and one is as a person on the individual level, that how sensitive I became, how understanding I became, how responsible I became. Because earlier it was very much freedom, and we are not supposed to be in that particular pressure or stress that we are dealing with that particular disorder. So it was very much casual before we happened to witnessing this particular disease. But me as a person have been changed a lot, because now I understand what my mother went through, and what she deserves as a mother, as a human, as an individual, to be very happy, even if the disorder is residing with her. But still she deserves to be taken care of very completely, very lovingly. And um, because everybody knows that mothers are someone who just never fails in taking care of their family or their children. So right now it's us who is taking care, it's me who's taking care, and it's our responsibility. It's now our turn to understand how she raised us, how we how we have troubled her in our childhood for silly little things, from the from food to the essential supplies to everything. Now she really needs us. So through the years, what I really realized that uh, she's something, she's the whole universe of our world. So we are supposed to be there for her in every situation, whether she hits us, she she makes us stay up for the whole night. So I as a person, I as a daughter, realize that she has raised me with a lot of difficulty. In fact, every mother raises her children very difficult, with that difficulty, with that pain, with a lot of sacrifices. So right now, in that sensitive, if I talk about that sensitive aspect, I feel that what she went through. So I really can connect with her as a person, as a woman, or as a daughter. So it will. I am in that particular section. I feel really grateful because that happened, and she's not. She is not bound to that responsibilities anymore. Now she is very much like a child, and she's taking care of the, those what the disease is making her to do. So she is not taking care of anything, and she's in that relaxing mode, what I feel personally. uh, that's all, because it's a very important thing to understand why it happened, and why destiny gave her or chose her that particular thing. So I first in the place understood that and accepted that, and now I'm giving my best and trying to grow with every second what she's showing us.
Sure, and I think you touched on a lot of great points there. I love the idea of feeling more connected to her because you're now in that caregiving role that she was in when you were younger. I think it's such a beautiful way to have a beautiful outlook to have on the situation. Thank you so much for sharing that. My next question is about advice and what advice you would give to someone who's just recently become a caregiver or who's struggling to be a caregiver. What piece of advice would you offer to those people?
um, First, in fact, in any disorder, when something happened like that, some diagnosis happened and it came as a shock, the first advice, what I would say, is to actually realize that we cannot undo the situation. We cannot go back into the time. So, what the first thing should be the acceptance, first of all, that whatever happened, now it has been done. Now it's us who can change the approach. So instead of getting in that panic situation, and to in that complaining that humans complain that why does this has to happen with me or with my family, what we have done wrong. So that question arises. But what I would say that please accept what if anyone or in your knowledge or anyone happen to be this in that with that disorder, please accept that and try to have that positive approach, that it's not that impossible, that we cannot fix it, or we cannot take care of that. So it's not that it's an unknown person, it's our person, it's one of our family members, and we are now into the different role. So the care has to be more, the love has to be more, the attention has to be more, and the understanding has to be more. So understand that it's not that difficult. what we the caregiver needs to be very patient, very calm. We have to prioritize things that this particular responsibility is on the first place. So we have to do it on the very in a very our best role. Then we can look after the other things. So once we have that approach that this is very essential thing and we have to do it very positively, I think anything can be can be dealt with happy heart and positive mind.
Sure. And I love that. And I love that discussion of acceptance, because I think that is really challenging. I think that's something a lot of people struggle with. And then once you do accept what's happened to you, what's happened to your family, you can move forward together as a family and spend the time with a loved one in the best way you can. So thank you so much for sharing that. That's all the questions we have for today. So thank you so much for sharing your experience. It was really good
Very
to
much.
talk to you. And tune in next week for our next episode of Memories Caregiver Spotlight.